Your fertility journey with CCRM. In vitro fertilization, also known as IVF, is a fertility treatment in which sperm and eggs are combined to allow for fertilization outside of the body, with subsequent transfer of the embryo back into the uterus. IVF is a safe and effective process. The pregnancy rate by age is greater than that achieved with natural conception. If comprehensive chromosome screening of embryo is performed, the miscarriage rate is also significantly lower. Please remember that every patient's journey is a different one, and that your care will be individualized. This video will speak of the process in general terms that may vary based on your specific treatment plan and response. The first step in the IVF process is your evaluation, which includes your new patient consultation, fertility testing, and treatment planning. For those requiring more advanced treatment options, such as egg donation, sperm donation, and/or gestational carrier, you will follow the IVF process, but you will also require time for selection of GC, donors, and the legal process involved in securing those contracts. Following testing, the second step is your cycle prep, when your doctor will create your individualized treatment protocol. Your nurse will educate you on your protocol and corresponding treatment calendar, will help you order medications, teach you how to self-administer any injectable medications, will inform you of what to expect next, and will review the do's and don'ts to help ensure your IVF cycle is successful as possible. The third step involves calling your nurse on day 1 of your menstrual cycle to report your cycle start. You will then self-administer your stimulation medications as indicated by your calendar, usually twice a day. During stimulation, you will come to our clinic for an ultrasound and blood work so your doctor can see how you are responding to your medications. Monitoring appointments typically take place every couple days depending on your response to the medications. After each appointment, your doctor will meet with your nurse and will review your ultrasound and blood tests to determine how your body is responding and if any medication adjustments are needed. The monitoring stage can be the most difficult to juggle along with your personal and work life. Be prepared for many appointments and visits to the clinic during this step of the process. CCRM has many monitoring locations to help make this step in the process as convenient as possible. So, what exactly is happening to your body during stimulation? During a typical menstrual cycle, your body matures one follicle that releases one egg. Stimulating hormones help the follicles grow and release multiple mature eggs at one time. The antral follicle count performed during your initial evaluation will provide a general predictor for how you should respond to stimulation. During your monitoring appointments, the ultrasound will measure how many follicles are growing and how big each follicle is. Our goal is to safely grow as many follicles as possible, at which time you will be instructed to administer a medication called a trigger shot, which will release the mature eggs to be retrieved by your doctor. How you can expect to feel during IVF depends on the types of medications you are prescribed and their side effects. Not every patient experiences all of these physical or emotional symptoms. These are just some of the things that you could potentially feel as part of this process. If blurred vision occurs or any symptoms are progressive or concerning to you, contact your CCRM doctor. You will come to our clinic 34 to 36 hours following the trigger shot for your egg retrieval. On your retrieval day, you can expect to be at our clinic for about 4 hours total. During the egg retrieval, you will be under anesthesia or conscious sedation while the doctor collects your mature eggs during a minor surgical procedure, which is performed vaginally and under ultrasound guidance. Since you will be sedated, you must have someone come with you for the procedure and remain with you until the following day. You can return to work 24 to 48 hours following retrieval. Around the same time as your egg retrieval, if you have a male partner, he will provide a semen sample or previously frozen sperm samples will be thawed and an embryologist will prepare sperm. Your retrieved eggs will then be fertilized in the IVF lab. You will receive a call or email from an embryologist with a report on the number of embryos that we were able to create. Your doctor will discuss the pros and cons of fresh versus frozen embryo transfer and what is best suited for your specific situation. If pre-implantation genetic testing, also known as PGT, of embryos is to be performed, frozen embryo transfer is required. PGT provides many benefits, including the prevention of passing on genetic diseases such as hereditary cancer, as well as reducing your chance of miscarriage. The majority of IVF cycles at CCRM are frozen embryo transfers for this reason, along with more recent data suggesting that this approach may be more successful. If a fresh embryo transfer is planned, this will be performed either 3 or 5 days after the egg retrieval. Hormonal support for the embryo will be initiated prior to that time. If a frozen embryo is planned in an agreed-upon cycle following your egg retrieval, you will begin uterine preparation to help with implantation. An additional benefit of using frozen embryos is that your hormone levels will have time to return to normal following stimulation before you start uterine preparation medications. Once your hormones have returned to normal, you will receive a new treatment calendar with medication instructions from your nurse. You will follow this new calendar to prime the uterus for embryo implantation. Your doctor will also call you with results from any pre-implantation genetic testing you may have completed, and will discuss plans for which embryos would be the best choice for transfer. On the day of your embryo transfer, your embryos are thawed and you will return to our clinic where the doctor will place a speculum and introduce one or multiple embryos into your uterus using a small, flexible catheter under ultrasound guidance. This minor procedure is relatively pain-free and typically does not require sedation. Valium may be administered as a muscle relaxant. Following your transfer, you will return home and rest for at least 24 hours. You can return to work and most other normal daily activities the following day. If you have questions about specific activities, please bring these up with your nurse or doctor. Approximately 9 to 14 days later, you will return to CCRM to complete a blood pregnancy test to confirm the outcome of the transfer. While you wait for your pregnancy result following your transfer, you may feel extra anxious, so it's a good time to ask family, friends, your partner, and/or a counselor for additional support. If you have any questions about the IVF process or would like to start your IVF journey with CCRM, visit ccrmivf.com